I'm Dr. Sanjay Basu, Head of Population Health here at Collective Health. Hope you're staying safe. I've been asked to talk a little bit about the risk of infection with the coronavirus that causes COVID-19. Especially as we move from shelter-in-place policies to coming back to work, there's a lot of concern about how risky it might be to be back in the workplace or at other places like schools and churches. What we know is based on an epidemiological concept known as the ID50, the infectious dose required for half of exposed people to become infected. Epidemiologists use the ID50 to classify different viruses and other microorganisms and determine what might be more or less infectious. In reality, the SARS virus that causes COVID-19 disease is in fact not the most infectious virus ever seen before, but is highly infectious, yet it requires two factors to become infected. One is being in prolonged exposure to a person who's infectious. The second is to have close contact. So if you're just briefly in contact with someone, say someone running by without a mask in a park, it's highly unlikely, thankfully, for you to get infected. More important are in places where you're in a crowded situation for long periods. This is why we worry so much about salons, restaurants, bars, and gyms. Those locations are much riskier than places where you briefly go in and out, and are much more worrisome than places that are in the outdoors, like parks and beaches. As long as you stay for a period of time that's limited and where there's a lot of ventilation, the risk of infection remains quite low. We have a lot of advice for workplaces that are reopening. It's important to improve their ventilation, change the ventilation and engineering settings, provide safe distances, and maybe even stagger people into cohorts so that they reduce the chance of infecting others. Most important is a strategy that involves rigorous testing, even of asymptomatic people, and doesn't just issue an immunity passport because we don't understand enough about immunity and how long it lasts to really provide safety. Instead, we should search for active infection through PCR testing or rapid antigen testing that is of high sensitivity and specificity. For more on these points, visit us at collectivehealth.com/insights. For now, I'm Sanjay Basu with the breakdown.